Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, I would like to say thank you for coming to my video. Okay, let me introduce myself. My name is Dika Alifah and I'm from Muhammadiyah Health Science Institute of Gombong. I will deliver material about hypertension or high blood pressure. Do you know what hypertension is? Let's get into the material.
Hypertension. Let's see. Hypertension is a public health problem where hypertension is one of the number one causes of death globally. Based on World Health Organization that around 922 million people in the world, 26.4% experience hypertension with a prevalence in Indonesia of 30.9%. What is hypertension? Hypertension is an increase in systolic blood pressure of more than 140 mm of mercury and diastolic blood pressure of than 90 mm of mercury on two measurements with an interval of 5 minutes in a state of rest or calm. According to Aspiani 2015, the causes of hypertension can be divided into two major groups, namely, 1. The cause of primary hypertension is not yet known, but it is estimated that primary hypertension is due to heredity, individual characteristics, and life habits. 2. Secondary hypertension is caused due to kidney disease such as renal artery stenosis, hormonal disorders such as pheochromocytoma, drugs such as oral contraceptive, and other causes such as pregnancy, brain tumor, etc. The risk factors for hypertension are divided into two, namely 1. Uncontrollable risk factor, 2. Controllable risk factor. 1. Uncontrollable risk factor. A. Gender. About 60% of people with hypertension are women. This is often associated with hormonal change after menopause. B. Age. The higher the age of a person, the higher the blood pressure. With increasing age can increase the risk of hypertension. C. Heredity or genetic. Individuals with parents with hypertension are twice as likely to suffer from hypertension than people who do not have a family history of hypertension. 2. Controllable risk factor. A. Obesity. Several studies have shown that someone who is more than 20% overweight and has hypercholesterolemia has a high risk of developing hypertension. B. Smoking habit. Smoking causes hypertension because the nicotine in cigarettes has a tendency to constrict blood vessels and arteries, which can lead to plaque. Plaque constricts blood vessels. C. Consuming excess salt in the diet appears to stop hypertension. Diet we are required to limit sodium salt intake to only 2/3 teaspoon or the equivalent of 1500 mg of sodium. D. Stress. The relationship between stress and hypertension is thought to be through increased sympathetic nerve activity, which can increase blood pressure intermittently. Ironically, prolonged stress can lead to persistently high blood pressure. E. Physical illness. Physical diseases is a disease that can cause hypertension to increase, namely uric acid, atherosclerosis, hypercholesterolemia, and hyperuricemia. Signs and symptoms. Most people with hypertension do not show symptoms for years. Symptoms that most often appear in hypertensive Patient if the hypertension has been for years and has not been treated include headache, fatigue, nausea, vomiting, shortness of breath, restlessness, blurred vision, and decreased consciousness. Hypertension complications can cause 1. Heart disease, 2. Stroke and cerebral brain disorders, 3. Kidney illness, 4. Retinopathy, damage to the retina. Prevention. Hypertension can be prevented by using drugs or by modifying a lifestyle. Michelle 2014 stated that lifestyle modification treatment can be carried out such as weight loss, sport, low-salt diet, increase potassium intake, calcium and magnesium, reduce alcohol intake, quit smoking. Tips for controlling hypertension. 1. Know your blood pressure. Normal blood pressure 120/80 mm mercury. 2. Control your blood pressure regularly. 3. High blood pressure is often asymptomatic. 4. Uncontrolled blood pressure will cause complications. 5. Ensure availability of medicine at home. 6. Be careful using over-the-counter drugs. This is the source for making this video. I think that's enough. Thank you for your attention. Let's stop hypertension for now on.
That's the material about hypertension or high blood pressure. That's all I can say. Thank you for your attention and goodbye.